Chlordiazepoxide is used to treat anxiety and acute alcohol withdrawal. It is also used to relieve fear and anxiety before surgery. This medication belongs to a class of drugs called benzodiazepines, which act on the brain and nerves, central nervous system, to produce a calming effect. It works by enhancing the effects of a certain natural chemical in the body. How to use? Chlordiazepoxide comes as a tablet and capsule to take by mouth. It usually is taken 1 to 4 times a day, with or without food. Follow the directions on a prescription label carefully and ask a doctor or pharmacist to explain any part you do not understand. Take chlordiazepoxide exactly as directed. Because of the wide range of clinical indications for chlordiazepoxide, the optimal dosage varies with the diagnosis and response of the individual patient. The dosage, therefore, should be individualized for maximum beneficial effects. Relief of mild and moderate anxiety disorders and symptoms of anxiety, 5 mg or 10 mg, 3 or 4 times daily. Relief of severe anxiety disorders and symptoms of anxiety, 20 mg or 25 mg, 3 or 4 times daily. Geriatric patients are in the presence of debilitating disease, 5 mg, 2 to 4 times daily. Preoperative apprehension and anxiety, on days preceding surgery, 5 to 10 mg orally, 3 or 4 times daily. Contraindications. Chlordiazepoxide hydrochloride capsules are contraindicated in patients with known hypersensitivity to the drug. Precautions. Concomitant use of benzodiazepines including chlordiazepoxide and opioids may result in profound sedation, respiratory depression, coma, and death. Because of this risk, reserve concomitant prescribing for these drugs for patients for whom alternative treatment options are inadequate. In elderly and debilitated patients, it is recommended that the dosage be limited to the smallest effective amount to preclude the development of ataxia or oversedation, 10 mg or less per day initially, to be increased gradually as needed and tolerated. In general, the concomitant administration of chlordiazepoxide hydrochloride and other psychotropic agent is not recommended. Side effects. Along with its needed effects, a medicine may cause some unwanted effects. Although not all of the side effects may occur, if they do occur, they may need medical attention. Check with your doctor immediately if any of the following side effects occur: rare, fainting, motor or mental changes, shakiness or unsteady walk, unsteadiness, trembling or other problems with muscle control or coordination,